65-year-old woman who came in with vague abdominal pain. Any thoughts?
My resident has a guess. Go ahead. This is Alexa. Go ahead.
Really?
Yeah.
Organ of zuckerkandl, paraganglioma.
Paraganglioma? Okay.
Of the organ of zuckerkandl. Yeah.
Guesses from us?
Might be a little low for that.
Little tad bit low, but where are the other?
We radiologists always talk about the extra adrenal paragangliomas being most common at that organ of zuckerkandl. Maybe it's just because that sticks to your head, but I think statistically they're more common to be up somewhere near the adrenal glands. More likely, if they're extra-adrenal, they're still more likely to be in the vicinity of the adrenal glands than they are down here in the organ of zuckerkandl. And I only know that because Eric Greenberg just gave us that fact in a lecture he gave here last week.
For your resident, I'm going to point this out. There's a lesion in the bowel.
Okay. Do you want to?
Maybe it's missing something that we normally see in these cases, like calcification.
Maybe. Any other differentials that you would put on your list?
Oh, we're adding carcinoid to our differential now.
Okay. So the patient went on to get this, an octreotide scan. And so we see increased uptake corresponding to the mass, which is consistent with the second consideration of carcinoid. The patient went on to get resected, and it came back as a well-differentiated neuroendocrine tumor. The patient's, she didn't have any flushing or diarrhea symptoms, but her serotonin markers did go down after resection. So which of the following is true about carcinoid carcinoids? Carcinoid syndrome is seen in 70% of cases. Carcinoids are a type of neuroendocrine tumor. Ileocarcinoids commonly secrete gastrin. Classical presentation of ileocarcinoid is solitary mass. Any guesses? B. My residents, the consensus is B.
My wonderful residence also goes with B.
So carcinoids are.
We're going for B, but we protest the term carcinoid because
yes, correct. Go
we
ahead.
don't use it anymore.
Yes. They're all considered neuroendocrine tumor, depending on the Ki-67 marker, on the degree of it. So it's either grade 1, grade 2, or grade 3. But they're all under that neuroendocrine tumor umbrella. So, but in the meantime, I'm going to refer to the well-differentiated, so grade 1 neuroendocrine tumor as carcinoid, because that was the WHO classification. So yeah, carcinoids are well-differentiated neuroendocrine tumors outside the pancreas and thyroid. We see them in the GI tract in 70% of the cases, and then in the chest in the rest. And there's a huge range. It could be benign and small, or it could be incredibly aggressive. Carcinoid syndrome are seen in 10%, and it has to do with whether there's it's an advanced disease. So if there's typically metastasis or lymph node, mets liver, or widespread lymphadenopathy, you will see that more commonly present with carcinoid versus localized disease. Jejunal and ileocarcinoid, which is what this was, are serotonin producing endochromatin cell tumors. They're multifocal in a minority of patients, and complications include SBO intussusception, which this patient did not have. They classically present more as a desmoid reaction, and Steve mentioned calcifications, which is not what this case was, which was a solitary mass, but this is what we classically think about when we think about carcinoid. Octreotide scan is positive because it the somatostatin receptor assesses the status and can help determine if patients can be amenable to somatostatin medications. And of course, the better agent now is dotatate, which is a lot more sensitive. So yes, 1/3 arise in primary small bowel, 1/3 are multifocal, and 1/3 have other are part of familial syndromes. So the answer is B. Yeah, carcinoid syndromes are seen in a minority, and ileocarcinoids secrete serotonin, not gastrin, and they classically present with desmoplastic reaction. Any questions?